Imagine giving birth to a child and your child looks like this. My dear, this is very sympathetic, and every parents that have a child like this, I pray that God help you in the management because it's really stressful. I know what emotional, mentally, even financially, like everything. So I'm going to be talking about this because it's now becoming rampant in Nigeria, and I don't like the fact that it's becoming rampant when the causes are something that you can actually avoid. So this is called cerebral palsy that normal Nigeria calls imbecile. They call it imbecile, imbe, all those things. The medical name is cerebral palsy. So what are the causes of this cerebral palsy? This is going to be a very long topic, so I'll be doing part one, part two, so the number of parts I'm going to do. So cerebral palsy is a non-progressive neurological disorder. Like once it has happened, it's a brain disease that happens from inside the womb, and once it can happen inside the womb during birth and after birth, and once it happens, it does not progress. It just stays stagnant like that. The brain damage just stays like that. It does not progress to worsen or it does not come back. So that's how it is. So what are the causes? There are causes that happen before birth, there are causes that happen during birth, and there are causes that happen after birth. So that's where I'm going to be stopping in this part one and then continue to part two. So the causes that happen before birth is number one is intrauterine infection. What is called? That means the child is inside the mother's womb and the mother has infection. And what are the type of infection that can cause it? It's called TORCH. TORCH. That's the infection that can cause it. So this infection is an abbreviation. T stands for toxoplasmosis. Toxoplasmosis. O stand that's TO stand for toxoplasmosis. R stand for rubella. C stand for CMV, cytomegalovirus. H stand for herpes simplex. So if you're pregnant and you have infection, any of this, please go to the hospital and treat yourself so that the child will not come out and be suffering in this world as a cerebral palsy patient. The next cause again, that when the child is inside the mother's womb, the causes one is placenta insufficiency. So now this is a medical term. Let me break it down. So the placenta is what transmits food from the mother to the child. So if the placenta is not sufficient enough for the child, placenta insufficiency, that's what causes, is not producing, is not allowing more nutrients, things that the child needs for the brain development, is not allowing it because of the insufficient placenta, the blood vessels and everything. The child is going to be coming down with cerebral palsy. So another thing that can happen when the child is inside the mother's womb is maternal hypertension and diabetes. This one is a very critical one because most women are very stubborn. They have hypertension during pregnancy, they have diabetes during pregnancy. They will leave the hospital and start going to maternity. What are you looking for in maternity? Maternity is just a midwife that will just help. If it's a normal delivery, she can deliver it. But it's not like when you have complication, you can't be going to maternity. Why? The child will come out and become cerebral palsy, and the child will passing through a lot. And you'll be looking at the child. Will you be happy with that? The next cause again before the child is giving birth, one is now genetic brain malformation. That one is coming from the gene of the child. So I'll be stopping here because this post is getting long. I'll be doing part two. Comment, share, and follow so that you can check the part two. Bye, Dr. Spice.